you are the expert in this field. You need to take possession of your invention and your intellectual property to get the best out of your portfolio. And so we hopefully will give you some tools to help you work out what's already out there.
If we can have a new generation of people leading companies that actually take an interest in their intellectual property, that will help, because the worst days that I have in this job are working with clients who have no clue what they're doing at all.
It's never too early to contact your tech transfer.
So if you work in academia, we always emphasize disclosing early.
You want to fail fast. You absolutely want to fail fast, because the longer that you go and you didn't kill that asset, the more money you're going to have to spend to get it out there, right? So if you're going to spend money to get to a phase 3, that's a really significant financial undertaking, and you would have rather have, killed that asset before you did it, so that you could move on to something that's more meaningful.
When we go to an inspection, to a facility, we need to now be very careful with evaluating that the data records are accurate, they are complete, intact, and maintained within their original context.
Look for holes in the story. Look for things about your drug candidate that would help it go from the lab, from discovery, all the way through commercialization and get to the patient. Because that's the whole point of company building, to make a drug that someone would use and benefit from down the road.
It's not written in stone, but I would say this is the most important document because it's the first one where terms are negotiated, and let's say that the other documents usually are negotiated and discussed among lawyers. So maybe for you as scientists and as founders, you can only have knowledge about the term sheet, and it's fine.
The next thing comes the technology. I know it sounds odd because it's a business tech, but that's exactly what happens. You need preclinical data, the proof of concept data, stage of development and next steps, and then you move to the operational plan. What are the milestones, technical and clinical, and regulatory strategy?
Venture capitalists invest these funds into the portfolio companies and manage them.
Companies are increasingly more capital efficient, and earlier stage companies are now able to start using rational valuation multiples, but that's not required. It's nice when the two line up between the startup valuation and what the company might be valued in the public market or if it got acquired, but you're usually using that as just a data point to compare if the valuation that you came up with by using the 20 to 25% target matches up with a reasonable valuation using a revenue multiple.
So one might think, why is it that in highly innovative products, access decreases 30% and in low innovation only 12%? Well, it's the cost, right? So low innovation is lower premium price, is lower co-payments. So there is not the barrier of pricing and access limitation that you have in highly innovative products.
We need all of these skills. All of these skills need to be wrapped up into a person, a team, and a way of thinking.
Cold calls are just always useless. Instead, what you should do is get a qualified referral from someone who knows the investors.
The reality is that most of the jobs that you will have in your career will not come through being posted on a website or even LinkedIn or whatever. It's going to come through your network.
You want gender diversity, you want cultural diversity, you want background. Sometimes you can get challenged by people that think differently, but then you will be enriched by the experience, and for sure your team will be stronger.